Hi, I'm Dr. Andy Thompson. This is COVID-19 update, April 1st, 2020. All data is of 8 p.m. Eastern Standard Time. All videos can be found on roominfo.com/blog. Current trajectories are the same as yesterday. United States passed 200,000 cases today. Canada continues to grow day by day, higher at day 20 than we were yesterday. Here are the reported cases per million population. Canada is roughly the same as Italy and Germany. Again, per million population, we're above France, United Kingdom, and the United States as of day 20. Here are the percentage deaths. Italy was the highest at 11.9%. Canada was low at 1.17%. Here are the actual numbers of deaths, with today's deaths being on top. You'll see Spain, Germany, France, United Kingdom, and the United States all had record numbers of deaths today. The United States was the first country to go over 1,000 deaths in a single day. Canada had 13 deaths today. Here's the deaths per million population. And this is of day 20, and you can see Canada is higher than the United States and Germany at this point in time. And if we expand this graph, we can see how the United States and Germany have started to curl up, but certainly Spain and France, Spain and Italy, are the highest. Here's the estimated reproduction numbers, and you will see that Italy is still the only country below 1. The United States and Canada are still above 1, and this is in the last 7 days. So let's talk about how this virus spread. SARS-CoV-2 was sequenced on January 5th, 2020 in Wuhan, China. The first case of COVID-19 was diagnosed in South Korea on January 20th, 2020. And believe it or not, the first case of COVID-19 was diagnosed in the United States on January 21st, 2020. So what went wrong in the United States? Well, the first act was a failed test. South Korea quickly started testing using the World Health Organization test. And they actually did 75,000 tests in the month of February. And they got ahead of the outbreak and became a model for other countries. The United States tried to develop its own test through the Centers for Disease Control. Unfortunately, that test was flawed and it was delayed. And it took 50 days from the first case until testing was really ramped up in the United States. They, in fact, only performed 352 cases in February compared to 75,000 in South Korea. So that was the first mistake. Mistake number 2, they were unprepared. They didn't have enough personal protective equipment, intensive care beds, or ventilators. The richest country in the world didn't have enough 75-cent masks. And furthermore, physicians and nurses who spoke out were gagged and muzzled, and some were even fired by hospital administrators. Act 3. Because of this lack of preparedness, healthcare professionals started to die. Initially in the United States, the government said that the young and healthy people can expect to recover fully and quickly. But meanwhile, in China, they'd lost some young physicians, and 54 doctors had died in Italy by late March. Healthcare workers see the sickest patients, and they're exposed to the highest viral loads. And physicians in New York and Boston are actually making end-of-life and funeral plans. The loss of each healthcare professional has a huge ripple effect. So Canada, we cannot follow the United States. COVID-19 is absolutely the worst public health care disaster in the history of the United States. We cannot look south for advice or guidance. We have to be leaders. So let's look at the number of new cases per day and see how we're doing. The United States is off on its own, growing very quickly. Canada is still the low point in new cases per day at day 19. But remember, we're behind all of the other countries, and they're ahead of us and have more cases. And I'm going to show an example of that in a second. Here are the new cases per day in Canada. We had 1,119 today. So we're all happy, thinking we're doing pretty well. But when we compare ourselves to South Korea at this time, we're not. We're still going up, and South Korea was definitely coming down at this point in time. And I'm going to show this calendar. And if you look to the 24th of March here, we had 2.8 thousand cases. Go forward 8 days, and we've now got 9.7 thousand cases. The United States has gone from 53,000 to 214,000. Okay, and that's 300% growth. Italy has only had 57% growth. Spain, 160% growth. Germany, 144. France, 159. United Kingdom, 263%. And Canada, 246% growth in this time period. I want to note one thing here. United Kingdom, last Tuesday had 8,000. Now they've had almost 30,000. We've got about 10,000 today. Where are we April 9th? Hopefully not near the United Kingdom. Here are the cases per 1,000 hospital beds, and you can see we're sandwiched right between Spain and Italy, still at second place. And these are the graphs from John Byrne Murdoch. These are the trajectories of all the countries. And you'll see the United States growth is higher and steeper than any other, and this is due to the lack of early testing. It's really taken its toll. Action now is probably becoming too late, even though they have locked down the state of Florida today. Here are the deaths. Takeaway points here. The United States has more deaths than France had a day earlier in its outbreak. The United Kingdom death toll is now higher than Italy's at the same stage. Here are the subnational regions, and the takeaway points here is Madrid has started to turn the corner. New York, as I said yesterday, is now the global epicenter of the coronavirus. Every day brings far more deaths than the day before. And now London, England's death toll is now higher than Wuhan's at the same stage of its outbreak, and higher than Italy's at the same stage. This is a curve that looks at deaths over time. And takeaway point here is that the lockdown in Wuhan was introduced on January 23rd, 69 days ago. The entire Wuhan curve has happened since January 23rd. It shows how long it takes for the effective control measures on the number of deaths. So if you look at Wuhan and you think about these other countries, these other regions in the United States and Europe, how long is it going to take to settle these regions down? This is not an April Fool's joke, folks. This is terrible. So again, Canada, what do we need to do? We need to get ahead of this thing. If we get too many cases and too many hospitalizations, our resources are all going to go to that, and we're going to forget to start testing and isolating. We need to do that now so we can limit the number of cases that get to our hospitals. So write to your Prime Minister and your Premier, your members of provincial parliament, and your members of Parliament. It's really important in the next week. The next week or two are critical in our country. Hold the line. We need to hold the line. Don't let this virus escape. A good way to support your local small businesses and frontline workers is to purchase one of these great hoodies or t-shirts from collinsclothiers.com under Canada Strong. You'll really support your small businesses and frontline workers. And again, folks, do your part. Flatten the curve. Please, please stay home. Please stay safe, and please save lives.